Good evening, my viewers. This is the latest edition of the George Ondek Show, Get on Deck with George. And tonight I'm very honored to have two friends of mine. They've treated me at the VA hospital in Kingsbridge. One is a dental hygienist and one is a dentist. I'd like them both to introduce themselves to my audience. Dr. Z, what is your name?
My name is Dr. Zhurakovsky, Dimitro, first name is. Like I said, I've gotten to know you over the years in the VA hospital. I'm now a dentist. I'm practicing in Manhattan.
And I have the lovely Jennifer with me. What's your last name and what's your job with dental work?
Well, my name is Jennifer Tompkinson. I'm a registered dental hygienist and I clean teeth for a living. But,
that's a very honorable possession. That's a very honorable job to have.
Yes.
And I'll attest that you do a very good job of it because you clean my teeth.
That's right. That's right. And you're a good patient.
You know, on TV, sometimes I hear very negative things about the VA. I must say I've gotten the most excellent care at the VA hospital in Kingsbridge, especially in the dental office.
Thank you. I'm sure I'm speaking for both of us. It's a great place to work at. Not only you're serving America's best, but the teamwork, everything that's happening there, the level of care that we provide, the technology that we have there is just. I mean, I'm sure it's out there also in private facilities, but it's a great place to be at.
And doctor, I have to congratulate you. You've just left the VA for private practice. What firm are you with and where are they located?
I don't know if it's a congratulatory statement, but
yes.
It's bittersweet.
Yes.
But I did venture out in a private practice. I'm working for a practice in Manhattan. It's on Park Avenue and 56th Street.
And
it's
what's
called Park 56 Dental.
Uh-huh.
So I'll be treating patients there.
And your background, your nationality, you're
Yeah.
Ukrainian?
Yes. So I was.
I feel like we're brothers. I'm Czechoslovakian.
That's
with a little
nearby.
Polish thrown in there.
Yeah, I was born in Ukraine and came here probably 13 years ago or so. And then started getting into dentistry, and little by little.
What made you get interested in dentistry? Has anybody else in your family been a dentist or a doctor?
A medical doctor. So I have a lot of medical doctors in my family, and it was, I guess growing up in a family of medical professionals, you were sort of, not that you were pushed towards that direction, but all this talk about medicine and something in health field. So I was sort of not predestined to go into that, but I really enjoyed it also. But on top of that, I really liked, sort of as cliche as it sounds, working with my hands. Mm-hmm. So I would fix things around the house, build things. I enjoy motorcycling. I work on that a little bit.
Motorcycle enthusiast?
Yeah, it's a bit of my hobby. Yeah. And then one day my father said, he's like, you should really look into dentistry because it's not only medicine, it's not only treating patients, but it's also it's an art. It's working with your hands, making it happen the way you see it, with smile design and everything like that.
Why is it important for people to go to a dentist and have the proper care of their teeth?
Well, I mean, it's like we have one set of teeth once we're adult. That's the set of teeth that we have for the rest of the life. I mean, I'm not talking primary teeth when you're a kid. So it's, a lot of times the diseases that you have or that you may have, they don't show, visually. It's not like you look in the mirror and you see something's wrong with it. So it's generally a good idea to see a dentist every 6 months, just for a checkup. There's a lot of conditions that could be diagnosed through a dental checkup.
And save teeth, right?
Well, exactly. That's part of it.
Most people wait till they got a toothache and then it's too late.
Usually that's too late.
Usually
that's too late. Yes. So generally speaking, prevention is a lot easier and financially easier as well than trying to fix what you have, if it's too late.
And speaking of prevention, we have a dental hygienist here tonight.
Yes,
what is your last name, Jennifer?
Tompkinson.
And Jennifer, how did you get into dental hygienist's work?
Well, I've always wanted to help people, and
Uh-huh.
I can relate with Dr. Z. I always like to work with my hands. So being behind a computer just was not my thing. You know, I wanted to work with my hands. I wanted to help people.
And you're a people person.
I'm a people person, and it's just enjoyable to see people leave with a smile and feel nice and clean and happy.
Why is it important for people to keep their teeth clean? And
Well, a lot of the things that Dr. Z was saying is correct. It's very important because there are certain things that can be diagnosed, or you can, you know, find out certain things that you didn't know that you had because of.
There are plenty of other conditions in the body that could be diagnosed just by looking in the mouth and doing
Really?
a proper head and neck exam.
didn't
Right.
know that.
Yes, so a dental visit should always start with a head and neck exam, where it's not looking at teeth; it's actually looking at everything but teeth, to see how how your neck is, how everything around your teeth are, and that's really how.
And Doc, I know you do all phases of dentistry, but you specialize in certain areas. Like I am about to get implants because I'm a very severely disabled veteran, and that's one of the benefits they give to a veteran.
Yeah. So after being at a place like James J. Peters Hospital, the Veterans Hospital in the Bronx, I do pretty much most of the phases of dentistry. Implants, I concentrate on implants, aesthetic dentistry, and like you said, you're getting implants and things like that, and like full mouth restorations. So we do all of that.
I want to get back to Jennifer now.
Sure.
Jennifer, can you kindly do a demonstration for us on
Sure.
how people should properly take care of their teeth?
Right.
And I see you have a little prop here
Yes,
you
we have
brought
a little
with
guy
us.
here.
Okay, and
It's a
this is
little
going to help people save their teeth
Right.
so they don't have to go see
That's
the
right.
dentist.
That's right. We're trying to avoid seeing you, Dr. Z.
But we don't really want to do that. But what we do is want them to keep their mouth and their teeth clean, and you can
Right.
show the proper way of
Right.
doing it.
Well, an important
What's that
thing.
little guy's name, by the
Oh.
way, with the two big eyes there?
Well, what is his name? We don't have a name for him
Well,
yet.
let's call him Elmer then.
Elmer. Okay, so we have Elmer here. We're going to be brushing his teeth. The most important thing, well, one of the most important things is not to just brush the teeth that you see. You want to make sure that you're brushing the insides and the biting surfaces as well. You want to use a soft bristle toothbrush.
A soft bristle.
Soft one, because a medium or hard bristle could actually cause some more wear to the teeth or the gums. So that's important. When you're brushing, it's important to actually create an angle, because if you hold it flat, it's not going to get close to the gum line, this little C-shaped area. So you actually want to hold it on an angle and just gently massage and then kind of sweep down. So just remember to keep that little angle and sweep down. That way you'll get right around the little contour here, because if that plaque sits there long enough, it'll contribute to gum disease.
Why is it important for a person like me who's getting implants to keep the screws that they put in your mouth clean?
Well, we want to keep those screws there. So, if we keep the plaque away, most likely
so you
we'll
got to keep.
the.
And is there a special device a person should be using if they have that before they're getting their implants? A rubber tipped.
There's
What's that
rubber-tipped
called?
instruments or proxy brushes and different
Water picks.
water picks. There's all sorts of things to help clean around implants. Yeah.
And a little bit about your background. What nationality are you?
Well, I'm American, but I'm Irish, German, and English.
Oh, it's a good combination.
Tompkinson's English. last name.
Tompkinson. Huh?
Yeah, that's
And
English.
where are you
last name.
originally from, and where's your family
I'm
from?
Staten Island.
Oh, that's a good little
Staten Island.
island there off of Manhattan.
That's
A
right.
nice, quieter island and green, as I remember it, but
Right.
has it changed a lot?
Oh, it's again pretty populated.
That bridge is very
Yes,
expensive.
that is
The
very
way to
expensive.
go is by the Staten Island ferry, right?
Yeah, that's still free. Believe
It
it or not.
is. Wow.
Yeah, believe it or not.
But getting back to dentistry, we now know how to clean your mouth properly, so we don't have to see him. But if people have to come see you, it should be every 6 months.
Yeah, generally speaking, every 6 months, that's a good interval checkup, and I'm sure cleaning most of the time. So the one thing that I wanted to say about the cleaning also, and I find this is not many people know this, and we were showing the brushing technique. It's about flossing.
Oh, yes.
A lot of people, a lot of patients that I interact with, I ask them, oh, someone showed you, how to floss and everything, and most say yes, how to floss. And I ask them, so what's the sequence of events, when you start your hygiene routine at night? And a lot of patients actually floss after they brush their teeth. So that's when I tell them you have to floss before.
Oh, I never knew
this
that
way.
before.
This way you can, get everything out from between the teeth, and this way the toothpaste that has fluoride in it can get there to
Right.
help rebuild enamel and do whatever it's supposed to be doing.
Doctor, can flossing cause damage to your teeth if you
And
don't do it correctly?
Absolutely.
I've heard that.
Absolutely.
Down at the gum line.
Absolutely, yeah. If you're going,
Too deep?
too strong, too deep, you're not supposed to be doing like a sewing motion. You're supposed to go in and out.
In and out.
So if you're doing it too strong and things like that, yeah, it can cause recession. You can damage your gums like that, yes.
So you not only should brush your teeth, you should use an antiseptic as well when you.
I mean, generally speaking, I think that would be an adjunct. So something like one of these
Listerine
over-the-counter rinses, things like that. To me, it's more of an adjunct. It's if you're going through your day and you go out and have lunch at work, and you don't have a toothbrush with you to brush your teeth, you can just rinse it out. And there's plenty of these rinses that have fluoride in it, and they do great antibacterial job and things like that.
There's been quite a campaign in some towns up around where I live to get rid of fluoride, because they says it's dangerous to other parts of the body or something.
Yeah,
do you go along with that theory, or
there's evidence to support the other side of that argument.
Yeah,
so there has
that's
been
what I'd like to hear.
there has been some studies, and usually there's some unfounded studies that claim that fluoride is can cause things that a person would not want. But the fluoride that's in the water, the fluoridation, the water, there's no studies that has shown that at the concentrations that it's at.
And it definitely does preserve people's teeth.
Oh, absolutely. The rate of cavities went down dramatically.
Me so much of the people who are against shots, for
Causing
like
autism
polio
and
has basically been eradicated. It was a big thing when I was a young child.
Yeah.
And through the Sabin and Salk vaccine, you don't hear about it anymore.
Absolutely. Yeah, I stand more on the evidence side. There's studies showing this is beneficial. This is the way to do it. And I mean, if you take in too much fluoride, and sometimes a pediatrician can prescribe, a mother to give fluoride supplement to their kids if they live in a non-fluoridated community and things like that. And sometimes if it's too much fluoride, there are certain conditions that can occur, like fluorosis, where you have little spots in your teeth and things like that. But generally speaking, with the concentration that it's at right now, in water, it's not dangerous at all. It's safe.
Jennifer, again, I want to go over the proper brushing of your teeth.
Right.
Maybe you can tell us that too. You said the proper cleaning before.
Right.
But can they brush too hard and take the
Can
enamel off
Absolutely
their teeth?
brush too
So
hard.
what kind of brushes shouldn't they use?
Anything medium or hard, you want to
So it should
avoid
be a
that.
soft
Always
brush.
soft, no matter what dentist you go to, they'll always tell you soft, right, Dr. Singh?
Absolutely. And
So-
you can't
See,
just.
that's another thing I didn't know.
Right.
So I'm learning things tonight, and I hope my audience is learning things about dental prevention of cavities
Absolutely.
and losing their teeth.
And you can wear away your enamel very quickly, and cause gum recession because of
Right.
hard bristles on the brush and improper brushing techniques.
Right.
So like Jennifer was showing, go in a circle around the gums.
And I hear that's a big problem with people getting older, gum recession. I think I had a little bit of that.
Yeah, I mean that's sort of like a multifactorial condition. I cannot say that it's because people are getting older. There's things, the other things that get into play.
Brushing of teeth.
Brushing, good oral hygiene, things like that. I mean, age itself is not really a contributor. It's just over time, more of those things accumulate and sort of end up in causing it. So,
how bad is sugar for your teeth?
It's generally not good. The thing is to not let the sugar sit on your teeth. Yeah. Sugar is not bad for the teeth if it's there for a minute or 5 minutes or 10 minutes. But if you've had a sugary beverage or food, and you let the sugar sit on the teeth, and the worst is going to bed after having that.
Right.
That's when you let it sit there.
So you should always brush before you go to bed?
Oh, yeah.
Now, in the morning, before you eat breakfast or after you eat breakfast?
There's actually a study that just came out. I just read it not too long ago, that sometimes it's not advised to brush teeth right before you eat, because certain foods have acids in them.
Right.
And acids soften up the tooth structure. So when you brush right after it, you actually can brush away more tooth structure than you would otherwise if the teeth were not softer after these acids. So there's some studies suggesting that you should wait half hour after food to brush the teeth. This way you'll preserve more enamel. You won't brush it away.
I've heard orange juice has a lot of acid in it.
Yes, orange juice, soft drinks, things like that. They all acidic.
See, one thing in my life, I wish people would have told me, even a nutritionist, more about soft drinks. My one addiction was Pepsi, and I used to drink a lot of it. And you don't know this, I weighed 70 pounds more than I weigh today.
Wow.
One of the main things I did was get rid of sodas. Yes. A nutritionist told me there's 8 spoons of sugar in every 12-ounce can of. Yeah. Why don't they teach this in schools?
I mean, I think they do, but I mean, I'm not sure if there's corporate funding trying to push soft drinks and things like that. But we definitely need to.
Cigarette smoking is very bad for teeth.
Yes, it's one of the.
Glad I don't have that vice.
Yeah.
Yeah, smoking is one of the contributing factors for tooth loss and periodontal disease.
Really?
Yes.
Yeah. So it's actually one of the first things that if I see a patient in my office, and one of the first things that we discuss is hygiene and all this, but we also discuss smoking, and I really encourage them to stop or at least start weaning themselves off, because it does.
Now again, I'll get back to one of my main addictions is coffee drinking.
Yeah.
So should people brush their teeth after drinking coffee, because it stains your teeth?
It stains. I don't think coffee is. I mean, obviously.
But I drink it black, so
no sugar.
No sugar, no milk.
Yeah, I mean,
a real man drinks black coffee.
Yeah, I mean, generally speaking, coffee is okay. If it stains, I'm sure. A nice cleaning would, get rid of the stain and things.
Must ask your opinion. Tooth whitening, and I know some dentists who charge as much as $750 for 2 or 3 visits.
I can't comment on that, but yeah.
Or in northern Westchester here, where we're filming. You're both living presently in the city, New York City. And we have some very expensive dentists here, and I guess dentists are expensive everywhere. But like for 2 or 3 visits of whitening, like $750, is that worth it? And does it really whiten the teeth?
Oh, you definitely get a good result.
Right.
Whether or not it's worth it, it's I guess up to the consumer up to the patient to decide. But the in-office bleaching, things like that. I don't want to name the companies, but in-office bleaching really does get good results. You can get a significant amount of brightness back in your teeth.
As long as it's natural teeth, right, Dr. Z?
Yes. So crowns and dental work will not bleach. So
I'm going to tell you something funny. I won something at a fair. One of them, and they said the value on it was $750, but I can't use it because, as you know, I've got caps and I've got some.
Right.
Yeah, so generally dental work will not bleach. So if you ever thinking of bleaching, getting bleaching done,
if you've got caps, you can't get it done.
You should probably bleach the teeth before you need any prosthetic work done, and then match the shade of the prosthetic work to the existing teeth, not the other way around. Because
why is it important to catch periodontal disease in the mouth before it gets too bad?
Well, this again, this is
And
this.
how can you tell that your mouth
You
is...
really can't. You really have to go to the dentist. You know, in the mirror, your teeth may look perfectly fine, but you'll have a severe periodontal disease.
And
So, what periodontal disease is? Let me just explain. I'm not
Yes.
sure. So, what it is because of it's multifactorial. There's a couple of things that contribute to it: smoking, medical history such as diabetes, oral hygiene, some genetic links. So generally what it is the bone that's holding the teeth in, that's anchoring the teeth in your mouth, slowly starts to recede. So it's an inflammatory reaction to the biofilm, to the bacteria that's sitting on your teeth. This is why cleaning them is so important. So, and then once the bone starts receding, because bone does not like, infection, and this is pretty much what's happening when you leave bacteria plaque on your teeth. So the bone starts receding, and sooner or later it recedes to the point where the teeth get loose, and you start losing teeth. So this is that, and that's periodontal disease. So going to a dentist for checkups, for cleanings, we do screenings. We make sure we check we take the films and things like that to make sure that you don't have periodontal disease, or if you do, that we can maintain it or treat it in a timely fashion.
Let me ask Jennifer a question again
Sure.
on that. Plaque buildup. It can start a week after you get your teeth cleaned if you're not properly brushing
It
your teeth.
starts right away.
Right
Once
away?
Yeah, right
Wow.
away. It's a natural thing, and it will start right
So
away. So it's a
person
matter of
does
you getting
have
it
to
off.
brush their teeth every day.
Every day, twice
A day.
Yeah.
Now, what about carrying a floss around with you? And
It's an
after
excellent
every
idea.
meal,
I don't know
flossing as
if
well.
everyone's that enthusiastic about it,
Yeah.
but
If they want
it's
to
an
keep their
excellent
teeth
idea.
and they want to
you
have
know.
good teeth.
Well, they say floss only the teeth that you want to keep.
Wow, that's a good saying. That's a good advertising slogan for when you get your own practice someday. Floss only those. I like that.
Yeah.
Did you coin that, Doc?
No, I've heard it somewhere.
Getting back to your country, you left it as a young boy.
Yeah. I was 14 when I came here.
I don't want to get into politics, but I think
Yeah.
it's terrible today what the Russians are doing in your country.
Yeah, there's a bit of a conflict going on. Hopefully
Yes.
it'll resolve soon. But,
There is the opportunity, like in America, for capitalism for a dentist to make a good living.
As a country, they're trying. The capitalism is relatively new there. Ukraine was part of Soviet Union and then became independent in '91. But as a country, dentistry or other professions are not as developed. And
Do they still have socialized medicine there?
They do.
Like
They
under
do.
the communist rule?
yeah, they do. And it's good and it's bad, I guess. If it were developed enough, maybe it would have been a good thing. But right now, they're working on it. As everything, it takes a little bit of time to get going and to resolve things. And so.
Jennifer, is it important to get your teeth cleaned every 6 months, every 3 months, once a year?
Every 6 months is
Why
good.
every 6 months?
Well, you want to get them cleaned every 6 months. That way we can check you out as well and make sure that if there's something starting, a small cavity, we can get it before it becomes a big deal where you need a root canal or something more involved. So coming every 6 months
And again,
is really
I
ideal.
commend the VA because they have us come in, us
Thank you.
vets, every 6 months
Thank you.
to make sure we don't get into further problems.
So you get a phone call from us every 6 months.
Yeah. And that's good because people my age, 39 plus, get a little forgetful. So I think all doctors or dentists should do that.
I mean, yeah, that's a good.
We have a few in northern Westchester now who do
Yeah.
that all the time. But one thing I must say, a little negative, that if a doctor keeps you in his office 2 or 3 hours waiting,
Yes.
if he's going to bill you for missing an appointment, they're starting to do that.
Absolutely.
Then I should bill him $100 an hour
Absolutely.
for every hour I have to sit there waiting.
I take my timeliness very seriously, and I
No,
think
but
it's.
if it's something serious like major surgery you're doing,
I mean, I
you
I
don't
try
wanna-
to be on time every time. In fact, earlier.
and you don't want to rush through any
Of
patient
course,
who's
of
got
course.
a problem.
Right.
Of course, but
So how are you enjoying being on television for the first time,
Oh, it's
Jennifer
great.
and Dr. Z?
It's great. Thank you for having us.
Yes,
And
it's
it's
excellent.
an honor to have both of you because both of you have served me and helped me quite a bit. I'm very shortly going to have nice white pearly teeth again because I didn't take the proper care of my teeth. And if I had it to do over again, I would have been brushing every day and not drinking so much soda.
That's true.
And one other thing, Dunkin' Donuts, Boston cream donuts. I used to eat
That's
too.
your
Those are the
weakness,
best.
I know, they're delicious. But why is it anything that tastes good seems to be bad for you or
Yeah.
bad for your teeth?
Yeah, I'm not sure why that's it. Yeah.
But one thing that's very important, you should get sugar off your teeth, right?
Absolutely. So yeah, sugar is one of the things that definitely causes a lot of bad things if you let it sit there for a while. So drinking, like you mentioned, beverages that have sugar in them is not in itself a bad thing. It's just leaving that sugar sit on the teeth is a bad. So if you drink something, you rinse it out afterwards.
Oh, it's always a good idea to rinse your mouth.
Absolutely. Even if you don't have any rinse it, just rinse it out with water. Or
If you don't brush or well, you can't brush during the day when you're working, or if you don't have floss with you, if you
Yeah.
at least rinse your mouth
Absolutely.
out with
You can
water.
have little-
Now that's another key
Right.
tip.
you
that
can have
people
walking size bottles of rinses. They sell
Or
those. You
water.
can just have it in your pocket or water. Yeah,
As long as
salt,
it's not
water,
sitting
anything.
there, yeah.
Well, Dr. Z and Jennifer, I can't believe how the time has flown by tonight. We have about 2 minutes left in the George Ondek TV show that's seen all over the world on YouTube and
Nice.
in about 1 million homes in cable vision. What do you have to say in closing? And is there a number people can reach you if they have a dental problem? And
Absolutely. Thank you for having us, and
Yeah.
it's been
you.
pleasurable working with you and coming here to see you. Don't delay dental care. It's a lot. An ounce of prevention is
worth a
worth a
pound.
pound of cure. So don't delay it. Come
so
in
if
and
anybody wants further advice from you, are you willing to give a phone number? where they
absolutely.
can
I
call
think
you?
I think it's going to be somewhere in the on the screen, the phone number.
Yes,
So they
okay.
can definitely contact
So
me.
it'll be on the
Yeah, they can look
screen.
me up online, and I'll be more than happy to talk to them. And
And Jennifer, what would you like to say in closing out your first of probably many TV
Oh, well,
shows?
this is very exciting, and
It
I
has.
want to thank you for having me as
It was
well.
my honor. You both helped me in my dental work, and I feel it was an honor to have you both on tonight. And I think it's been a tremendous public service to my viewers.
Right.
yeah,
So
thank you
once
very
again,
much.
Thank you for being on the George Ondek show tonight.
Thank you.
To Jennifer,
Thank
thank
you.
you. And my viewers, till next time, this has been the George Ondek show. Get on deck with George. If you want to have nice, healthy, and beautiful smiles, you got to have a hygienist take care of your teeth, and a dentist check you every 6 months to make sure you're doing the right thing and do your proper dental care, and everything will be great. Until next time, see you, and thanks again, both of you.
Thank you.
Thank you.
Thank you, Jennifer.
Thank you.